I'm a Carer Engagement Officer from VMCH Support for Carers program. I'd like to begin by acknowledging the Wurundjeri people and the other peoples of the Kulin Nation as the traditional custodians of the land on which our work in the community takes place. We pay our respects to their elders past and present. I thought I'd just begin with a very quick intro about what our program does. Many of the participants today are already registered with us, and I will, throughout the webinar, just pop some additional information in the chat for those that would like a bit more information. So just very quickly, we are the providers of the Victorian state-funded Support for Carers program in the Eastern Metro area. So that covers the areas of Boroondara, Manningham, Whitehorse, Monash, Maroondah and Knox and the Yarra Ranges. And there are sort of two aspects to our program. There's the short-term case management side of things, which also includes some needs-based brokerage of services. And there's also the carer engagement side of things, which is what I do, and that involves a little bit of community development with other organisations, and also activities, events, and educational workshops for carers. If you don't fall within the service areas that I've just listed, I will also put in a chat a link to the service providers in your area that provide the same program as us. So yeah, I think, Evan, unless you'd like me to cover anything else, I think that's it from me.
Thanks, Amanda. That's a really lovely introduction and really good to hear a little bit more about where Villa Maria fits into it all. So hi, everyone. I'm the Partnership Coordinator for the Carer Gateway in Victoria, Evan Wallace, and I work for Merri Health. And it's a real pleasure to have everyone here. And I also would like to acknowledge the traditional elders of the lands upon which we meet today and pay my respect to elders past, present, and emerging. It's so good to see participants joining and coming on to today's webinar, and a really good opportunity to be able to step back and to talk all things Carer Gateway. And today we're really focusing on the theme that you can see on the slide at the moment, which is around accessing support. So when I say accessing support, what am I talking about? Well, I'm talking about the different stages through which you'll go by accessing the Carer Gateway, both from an intake, registration and emergency respite perspective, and then also too, looking at assessment and planning as well. So with today's webinar, you're going to be hearing from a few very special people that are connected to the Gateway. You'll hear from Vicky Down, the State Manager for the Carer Gateway in Victoria, who's going to be providing a really good overview of the Gateway and how it all works. Where did it come from and where's it going and where do you fit into it all? And then you'll hear from Sasha Lilford, who is the Senior Care Advisor based with Merri Health and doing a lot of work in particular with carers facing significant challenges and complexity within their lives. And then finally, you'll hear from Laura Humphries, who will talk about assessment and planning and the types of supports that can also be organised through the Gateway. So that's our journey today. It's a good array of speakers, but what is so important to make today's webinar really worthwhile and to ensure that you get out of this webinar what you want to get out from this webinar is that you ask questions. As you can see at the bottom of the Zoom screen, there's a Q&A box. Use that Q&A box to ask questions that you want to have answered around the Carer Gateway, around Villa Maria, where everything interconnects, intersects, whatever's on your mind. Aim today is to answer it. So put it in the box. I'll be facilitating questions because what I didn't mention is that we'll have a good session of Q&A at the end of today's webinar. But I'd like to start by introducing Vicky. Vicky is the incredible state manager for the Gateway in Victoria, a real passionate advocate for carers in the state, and someone who has extensive experience really ensuring that carers receive the support that they require. And so, Vicky, without any delay, I'd like to introduce you to talk about the Gateway and provide a real overview of the service that's really, in the scheme of things, relatively new.
Thank you, Evan. And good afternoon, everyone. I'm Vicky Down. I'm the State Manager of the Carer Gateway in Victoria. And I'd also like to acknowledge the traditional owners of the land and pay my respects to elders past, present and emerging. So what I'll do today is just do a little presentation just to take you through the Carer Gateway and what it means to carers. So in Victoria, the Carer Gateway is delivered by Merri Health in partnership with several other organisations, including Family Care, Bendigo Health, Uniting in the Eastern Metro region, Ballarat Health, Alfred Health and Barwon Health. And we also have a contract arrangement with Carers Victoria in the Western region who deliver services on our behalf. The Carer Gateway is an Australian government initiative and it was launched on the 6th of April this year. And the purpose of the Carer Gateway is to basically provide support to the carer, put carers in the middle and offer services that are tailored to carers. So I think there's a little video that I'd like to show you next. So I'll
Carers provide care and support for family members or friends with a disability, mental illness, medical condition, or someone who is frail due to age. In Victoria, there are more than 736,000 carers providing unpaid care. Victorian carers are as diverse as the people they care for, but all are devoted to providing emotional and practical support for their partners, parents, children, friends, or relatives. Carer Gateway is the Australian Government's national approach to providing free, dedicated care services such as counselling, online coaching and skills courses. It can also help carers access services and supports available through other providers. In Victoria, Carer Gateway services are led by Merri Health and provided in partnership with 6 other community organisations: Alfred Health, Ballarat Health Services, Barwon Health, Bendigo Healthcare Group, Family Care and Uniting are providing a range of tailored services as part of the Carer Gateway network in Victoria. To learn more about how the Carer Gateway can help you in Victoria, visit www.carergateway.gov.au or call 1800 422 737 Monday to Friday between 8 a.m. to 5 p.m. Carers provide care and support for family members.
Apologies for that, we got the video started again. So I'll just go on. As most of you know, well, most of you here today are carers, but I'll just explain who a carer is. It's usually a person who provides unpaid care and support to a family member or friend with a disability, mental illness, chronic health issue, or an age-related condition. Becoming a carer can be gradual or it can happen suddenly due to an accident or an illness. Carers can be any age. Children and young adults under 25 years of age are also carers and are called young carers. All caring situations are different. Some carers look after another person 24 hours a day and help with daily living, while other carers look after people for a few hours to help with everyday things. Eligibility for the Carer Gateway. So anyone who is an unpaid carer can receive support from the Carer Gateway. So you're eligible regardless of whether the person you're caring for is receiving a package like National Disability Insurance package or a home care package or receiving other support such as the Commonwealth Home Support Program. So there are no limitations. There are no citizenship or residency requirements. Asylum seekers can receive Carer Gateway support. And if you're in receipt of Centrelink payments like care allowance or carer payment, it doesn't affect your eligibility in any way for the Carer Gateway.
My name's David, and caring for 3 people, of which I can describe as being one, my daughter, my lovely wife, and my lovely mum. Seeking support was something that in hindsight, I probably should have sought a lot earlier in the process of being a carer. If I had have actually taken on board accessing support services and even listening to those that are close to me, I would have probably have realised early in the piece that it's vitally important that you get a lot of information.
So I just wanted to go through some of the services that are available. So you're able to contact the Carer Gateway via the national 1800 number, which is at the bottom of the screen, but also we'll put it up at the end of the presentation, or also via the website. So the sorts of services you can get face-to-face are carer support planning services. So what that is a carer support worker will meet with you and develop a care plan that supports you and also links you to services that are in the community. We also offer carer-directed support packages, and there are 2 types of carer-directed support packages. There are the $3,000 packages for planned respite, and they can go over a 12-month period, and they're usually there to assist carers to access planned respite, home care or personal care, or provide assistance with transport. We also offer face-to-face counselling, but at the moment, because of COVID, most of our counselling has been offered online. We offer in-person peer support, which allows you to engage with other carers who are going through similar experiences and gives you an opportunity to socialise and debrief with other carers. We offer emergency respite. So if you're in a position where you're unwell, or you're being rushed off to hospital, or there's been some sort of emergency and you're not able to care for the person for your family member, you can contact us and we can assist you with emergency respite. And that's regardless of whether the person you care for is accessing NDIS or My Aged Care. And we also offer information and advice. In terms of the Carer Gateway website, the services offered there include online peer support, phone counselling, which is delivered through Catholic Care, online coaching and skills courses, and there's quite a bit of material there that provides information and advice and resources for carers. I mentioned carer-directed support before, so I'll just go discuss it a little bit more in detail. So the carer-directed support packages, as I said, are offered either as one-off practical supports, and so the sort of things you can get from those packages include things like a purchase of a laptop to assist carers if they're thinking about re-engaging with education or employment, or also payment for training courses. I know we've been affected by COVID this year, but I know there's been carers who've accessed courses either online, or they've accessed courses that have been delivered in other forms. So we're happy to pay for those. Also the care-directed packages, as I said before, we can fund practical supports to assist carers, and that includes planned respite, which can be direct or indirect, which means it can either be direct respite for the carer, or it can be indirect where the carer can use it for home care services, assistance with shopping, assistance with meals, or assistance with transport.
My name's Courtney and I'm a carer for my mum who has multiple sclerosis. Connecting to services does definitely help you get through the rough times, because without those services and resources, and even just knowing that they're there for an emergency, it does take that little bit of pressure off you. I do find counselling to be a big, big help. It's nice to have someone else in a safe space where you can go, hey, this is how I'm feeling, get that off your chest so you can give the best care that you can to that person that you're helping to look after.
So yeah, as that video showed, we do offer counselling, so it's a free service. So if you contact us from 8 a.m. to 6 p.m. on weekdays, we can assist you by referring you to a counsellor. We have a range of counsellors who deliver services who are subcontracted to the Carer Gateway, and we will try our best to link you into the most appropriate counsellor for you. Also, if there's a particular counsellor that you've been seeing for a period of time and you would like to continue seeing them to assist you with issues that you're facing in your caring role, we can also look at providing that support to you as well. So counselling is usually something that carers access if they want to talk about their feelings, if they're suffering from anxiety, depression or stress, and want to work on strategies to help them manage in their caring role. Counselling can help carers manage their own well-being, and we can actually provide you with up to 6 counselling sessions, and depending on how you go, there might be the potential to extend that. And counselling, as I said, is available over the phone, online and in person. In-person peer support is a carer-led forum that enables connection with people in similar circumstances, learning from peers through the sharing of lived experience of being a carer, and relief from carer stress through personal connections and stories. We have quite a few in-person peer support groups that we deliver, and if carers are interested, we're happy to put you in touch with the one that's local to you. As I said before, respite is when someone else takes care of the person with care needs. This allows the carer to have a break. Respite care can be for a short time, for example, a few hours each week, or it can be for a longer time, including overnight respite or respite over a weekend. Planned respite can also help carers plan for regular breaks to rest and recharge. This is accessed through the carer-directed support packages, and emergency respite care is available at short notice. So how do you contact us? You can either browse the Carer Gateway services by visiting the Carer Gateway website, which is the Commonwealth Government website, which is carergateway.gov.au, or you can call the Carer Gateway team on 1800 422 737. You can also register for a callback on the Carer Gateway website. So if you don't have time to call, but you would like us to call you, you can actually go onto the Carer Gateway website, register your details and a time that is most suitable for us to call you back, and we will ring you at that time. You can also access supports by contacting your local Carer Gateway provider, but we encourage you to come through the 1800 number or the website if preferable. As I said, that's our number there, 1800 422 737. It does say the hours are 8 a.m. to 8 p.m. We were offering those hours during the COVID lockdown, but now our business hours are 8 a.m. to 5 p.m. However, if you're ringing after that time for emergency respite, we have an emergency after hours response service that can assist you with any sort of urgent respite needs that you might have. You can also contact us via the Carer Gateway website by asking for a call back. And that's it from me.
Thank you very much, Vicky, and thanks for providing that overview of the Carer Gateway. Really excellent overview of the different types of supports that can be delivered through the Gateway to carers, how carers can also reach out to the Gateway itself too. So really, really informative there. Thanks, Vicky. We now move to our next presenter, who is the Senior Care Advisor for the Carer Gateway in Victoria, Sasha Lilford. Sasha has a really extensive background working with carers, working in the health sector, and super switched on when it comes to connecting carers across the community. Sasha's going to give a introduction to how intake, emergency respite, registration works through the Gateway, and also some of the work that she does behind the scenes for carers who might be experiencing a few additional challenges within their lives. So Sasha, over to you. And then I see that we're getting a few questions coming in, so I'll be sure to ask a few once you've finished. And for everyone out there, just keep putting those questions in the question box.
Thanks, Evan. Hi, everyone. My name's Sasha. I thought I'd drop in today just to give an overview of how it all works in reality. So Vicky's given a brilliant overview of all the different services and supports that are available through the Carer Gateway. And so we wanted to check in today and really talk through how that works in reality. So the first part of the process of accessing the Carer Gateway, as Vicky said, is to call in that number or to ask us to call you back. And the first step that you'll go through is to speak to one of our intake team. They're called the Carer Response Officers. The role of the Carer Response Officers is to have a brief chat with you and really get an understanding of your caring role and just make sure that you fit our eligibility criteria, as Vicky outlined in the slides, to make sure that you're in a caring role for a family member. Once we have established that, we'll get your consent and make sure that you're comfortable with us recording your details on our database and on our system, and got all of that sorted. So the next stage that we'll go through is the Care Response Officers will identify with you whether there are any emergency respite needs, so anything that's been unplanned. And often that's the case, and often that's the reason somebody will contact us in the first instance, is because there is an emergency situation for the person that they're caring for that needs support. So if there is an emergency situation that you need support with, we'll put that in place straight away and make sure that we get that sorted before getting you over to the local Carer Gateway partner in your area. So what I wanted to talk a little bit about today, and I know that it's a big question, is what is emergency respite and how does that work? Essentially, we see anything that impacts your caring role and is unplanned. So that could mean that you as a carer could be hospitalised in a situation that you can't plan for. So we would consider that an emergency. If you can't leave the person that you're caring for at home alone, the Carer Gateway is able to step in and provide some additional support to make sure that the person that you care for is safe whilst you're in that situation. It could mean that we help you find some facility-based respite. It could mean, if that's not possible in a short-term situation, that we might be able to get someone to come into your home and care for the person that you care for whilst you're in hospital. So it's a pretty dynamic situation, as you can imagine. Every emergency is slightly different. So it's going to be really hard for us to say exactly how we would respond to every situation. But in general, it's about just finding out what we can do and putting something in place on the spot as quickly as we can, and to make sure that that safety is guaranteed. Other emergencies would also include if there was, you might not be hospitalised, but you might not be able to carry out your caring role for another health reason. Or sometimes, unfortunately, in some situations, some carers are at risk of breakdown. It might be mental health breakdown. There might be a concern around relinquishment of care. I mean, these aren't ideal situations, but they do come up sometimes. So that's where we're able to step in and provide some additional support just to take that pressure off while other things can be stabilised. In occasion as well, if a carer is at risk of losing employment due to caring role in an urgent situation, we might be able to step in and provide some emergency support as well. So that's an overview of what emergency respite is, and the Carer Response Officers will do that intake, that registration of your situation, do that consent with you, and implement any emergencies if they are there. Generally, what would happen then is, depending on which region you live in Victoria, we would then send your details over to the local carer gateway partner in your area. And Vicky did mention those before. I know a lot of people joining today are from the Eastern region, so the partner in the Eastern region is Uniting, but we have lots of other agencies that we work with as well for different regions. So if you're in the Southern region, it would be Alfred Health Care Services. If you're in the Northern region, it would be Merri Health Care Services. So it just depends where you are. So in general, once we've managed that situation, taken your details, then we would send your details to the local carer gateway partner, and then they would get in touch and do some assessment and planning with you. And Laura will talk about that in a little bit more detail after we've discussed the intake part. We do, however, have an additional, I guess, a protective layer, which is where I come in. If you're in a situation of where there's high risk needs, or there's safety risks that we need to be addressed. So I'm the Senior Care Advisor for the Carer Gateway. We do have other care advisors as well. And so we are here to make sure that when you call in, if there are any immediate risks that need to be managed, they could include family violence, they could include any child protection issues that come up in our conversation with you, they could include your own mental health challenges. Our role as the care advisors is to make sure that we put in place any emergency supports or additional referrals, or get emergency services involved if we need to. So that's our role, and it's just that additional level of safety for you also. Once we've done that, then we, as I mentioned, send you over to our local carer gateway partner, and then we can start to do all of that planning around the fantastic services and supports that Vicky mentioned around carer-directed packages, all of that sort of thing. And yeah, Laura will talk through that in a little bit more detail. So that's all I wanted to say, other than Vicky did touch on the after hours service that we have. So if you are calling in after 5 and you do have an emergency situation, you can still call the Carer Gateway number, and the after hours service is 24 hours and they will deal with any emergencies as well. If it's not an emergency, it's a general advice question, then they'll get us to call you back during business hours.
Thank you so much, Sasha. We have a few questions, and just for everyone who's tuned into the webinar, there are some questions which you'll see on the chat function there. I'm also getting some information that's live from Villa Maria coming through on that. So be sure to note everything that's been put down by Amanda with respect to how this all interlinks with the Support for Carers program. We're also receiving questions too through the Q&A box. But for the webinar attendees, you won't be able to see those questions that are coming through. Only the panelists have access to those. So do keep sending the questions through. And we've had one question that specifically relates to how we respond to emergencies. It's come through from Mary Jane. And Sasha, Mary Jane has asked, at an emergency, I won't be able to contact you. Can you please advise if my son will be able to contact you? As you only have one number, what is the emergency number to call?
Great question. So absolutely, your son is able to contact on your behalf if you are in an emergency situation. There's slightly different consent rules around that if you were in hospital and not able to give consent. We do also get calls from social workers in hospitals as well. In a real emergency, if you were not able to speak, then yes, absolutely. So what we would do in a situation like that is speak with your son, get some really basic details and put them on the system, implement the emergency support. And then once you're able to speak to us and give that more detailed consent for us to deliver other services, then we would do that as well. The second part of your question is that it is the same number for all calls through to the gateway. So the 1800 422 737 will come through, whether it's after hours or business hours.
Thanks, Sasha. Another question that's come through from Iprasad. For the initial registration, does a carer need to go to their local partner or to Merri Health?
That's a great question. So every carer would come through that central intake through the carer gateway, which is that number that we've spoken about a few times today. So the idea is that it really simplifies the process, and that everyone comes through to the carer gateway at Merri Health for that real standardized conversation, and making sure that we're capturing all the data that we need to capture, and then you're getting that local support from wherever you live.
And then a question that's come through from Lai. Do you also help non-family carers like friend carers and neighbourhood carers?
Look, it really depends on the circumstances. There are times where neighbours provide significant support to someone. Absolutely. That's really where we'll do that assessment at intake. So if you're having a chat on the phone to a neighbour occasionally and talking to them, it probably wouldn't fit into a caring role. Having said that, if you are going to a neighbour every day and taking them to medical appointments and cooking them food and providing that emotional support, then there are circumstances in which we would absolutely support friends and neighbours.
And this question's coming from Giancarlo. Giancarlo has asked, how long would it normally take for emergency respite to be put in place?
Well, because it's an emergency, we do it as quickly as possible. We have some really quick turnaround. We have great relationships with the agencies that we work with to make sure that things are implemented as quickly as we can. So within a couple of hours, if it needs to be, absolutely, we would do that.
And one last question for you, Sasha, before we move on to hearing from Laura about all things assessment and planning. This question has come through from Shirley. Shirley says, if I had to be admitted to hospital suddenly and I can't leave the person I care for at home, is the Carer Gateway able to assist?
So this is a situation where the initial emergency, we consider that the Carer Gateway is responsible for managing that as quickly as possible. So if you can't leave them at home, as I mentioned earlier, we would try and get someone in the home quickly to make sure that we've got time to then plan other supports. So we could get someone into the home, say, for the rest of the day, and then that gives us a little bit of time. A bit of my role is often contacting home care package coordinators, or I'm contacting NDIS coordinators to find out what other supports are in place. So usually we'll buy ourselves a little bit of time by putting in that initial emergency respite from the Carer Gateway. Then we establish what other friends, family, other services are involved, and then get those services involved, or it buys us a little bit of time to then explore facility-based respite.
Thank you so much, Sasha, and thank you to everyone who is sending through these excellent questions. Do keep sending them through, either on the chat function or on the Q&A function. And as you can see, they're getting answered and they're getting put. And so really enjoying seeing that engagement that's there. And so with your engagement, we know that it's mission accomplished for us in terms of really making sure that people are starting to understand how they can access support through the Carer Gateway, indeed the name of today's webinar. So we now move to the second part and the second element of accessing support. So from Sasha, we heard about intake, we heard about emergency respite, we heard about what sort of stabilization work the Carer Gateway plays. And she also talked to the point at which referrals and carers are sent through from intake through to assessment and planning. And that's done by different assessment and planning officers based across Victoria, working for the various organisations that Vicky mentioned in her presentation. So it is a real pleasure to introduce Laura Humphries to today's webinar. Laura is an assessment and planning officer based with Uniting, and she's been there since the very early days of the Carer Gateway, and plays a wonderful role when it comes to identifying the goals, needs of carers, and putting the appropriate support into place. Laura is going to talk you through what that looks like from a Carer Gateway perspective and the different steps that are involved with assessment and planning. Laura, great that you're here. Over to you.
Thank you so much, Evan. Hi, everyone. My name's Laura. I work for Uniting. Uniting is the partner of the Carer Gateway that covers the Eastern Metro region of Melbourne. We also cover Gippsland, Goulburn North East, and also Albury, New South Wales. So from our perspective, our role is to support carers in terms of future planning. So we'll receive a referral from the intake team. So we will understand your situation. We will get in touch with you, introduce ourselves, and then we will arrange a time with you to conduct what is called the Carer Star Assessment. The Carer Star Assessment is a really great holistic tool that was actually developed in collaboration with carers that allows us to really understand your caring role in great detail. And the benefit of doing this is we get to have a really in-depth conversation about your needs as a carer, focusing on how we can best support you. Because carers are so varied, they have such different needs, they conduct so many different types of roles. The Carer Gateway provides support that is really tailored to you and your situation. And by doing this assessment with you, we can really nut out all the things that you may need assistance with or advice with, and we will be there to support you through that process. Once we conduct the assessment, then we can set goals with you and work with you to make sure.
Hey, Laura, it's Evan here. I'm just hopping in because there's a few challenges with your audio at the moment. So it's really glitching in and out right now. It's sort of a bit of a stop-start audio. So sometimes it can fix itself when someone sort of steps in. And then so the audio changes and goes back to you. So it was working at the start. Maybe give it another go now.
Otherwise, let me know. Maybe I'll try and switch my internet over.
Oh, I'm afraid, Laura, it's still really breaking up. So see what you can do by way of maybe changing settings on the microphone. But it's yeah, as Pam's and a few of the other participants are saying, it's just breaking up really badly. So and I can see that Laura's gone into a freeze there as well. So Laura's been talking about assessment and planning that relates to the Carer Gateway. And we'll see whether Laura's audio is able to boot itself back up shortly. So we'll give her a couple of minutes to do that. But as Laura was talking about earlier, central to the Carer Gateway is the Carer Star. And in fact, that's an approach that's used right across the country when it comes to understanding how an individual is faring within their caring responsibility. So Laura mentioned that we try to look at how the care is going in a holistic way. So rather than just sort of grouping things up and mashing it all together, instead we have a look at, all right, what's happening with respect to finances, what's happening with respect to health, what happens with respect to managing at home. And we have a conversation, and the conversation can go for really as long as it's appropriate for the carer. And from that point, we identify goals and actions. And we get the goals, we look at the actions, and then some of those actions will be about how we link better into the community and what sort of referrals might be appropriate and what sort of individual goals are going to be relevant for the carer. And other goals will be attached to the different types of funded support that are connected to the gateway, which Vicky talked about in her presentation, whether it's Respite or whether or not it's counselling or in-person peer support. But the key thing to know is that it's all driven through that initial conversation around the star and our role in trying to best identify what's going to work best for you at the point of time where you make contact with the Carer Gateway. So that is a broad overview, nowhere near as elegant as what Laura would be able to provide with respect to assessment and planning and the types of support that can come from it. We know that there are a whole range of different types of assistance that's there. I'm I'm more than happy to take your questions on the nature of assistance that we can fund and assist you with through the Carer Gateway. But I want to see whether Laura's connection's working and whether her microphone's working. And Laura, let's see, take two. How's the audio faring?
Take two, how's that?
Yeah, we're back.
Yeah.
That's awesome.
I'm so sorry, guys.
All good. We were just talking about the STAR and how that links onto a bit of support planning, but over to you. Back to you, Laura.
Excellent. Thanks, Evan. Thank you. Yeah, I did hear most of that. Evan just provided a really excellent breakdown of what we do during the assessment and planning process. What it means to have support through the Carer Gateway is to have someone who's there to come to. If you have any questions relating to your caring role, that's what we're there to do, is address the individual needs that you have. Whether that's supporting you to be connected with ongoing services that are available through other avenues, or whether that's support that's provided through the Carer Gateway, that's what we're here to do, is to make sure that you have one central place to go to make sure that you're getting access to all the support that you're entitled to. I just briefly wanted to touch on the difference between the Carer Gateway and the support that you can access through the Support for Carers program delivered through a state-funded provider such as Villa Maria. So all carers are entitled to be registered for both services simultaneously. And there are certain things that your state-funded provider can provide that perhaps the Carer Gateway cannot provide, and vice versa. The advantage of being registered with both is that you are basically receiving all the support that you're entitled to. And we can work with the state-funded carer provider to facilitate support for you. In my role, if I have a carer who comes through and they're not yet registered with Villa Maria, then we may provide you details through to Villa Maria to fill any gaps that may come about during assessment and planning, to make sure that you are connected with both. So we just want to make sure that everyone knows that that is something that you're entitled to do, and we encourage you to be registered with both services. You can contact the Carer Gateway if you have any questions about that, or if you're already registered with Villa Maria, you can contact them if you have any questions. Is there any questions that you had for me, Evan, in particular? Because I'm not sure what we haven't covered.
Oh no, Laura, that's great. Thank you for providing that that introduction around assessment and planning, and absolutely a few questions that have come through and a few questions of my own too. I'm just wondering, Laura, because we're coming to the end of 2020, wanting to see from your perspective what you have seen that's worked really well from an assessment and planning view, and whether or not you can think of a situation where the Carer Gateway has been able to facilitate some really positive supports for a carer in its own, under the style and approach that you just outlined.
Yeah, absolutely. The great thing about assessment and planning means that we get to work with carers over a relatively long period of time. It may be over a 6-month period or a 12-month period, but we get to see how things are happening for them ongoing. And during the pandemic, so many situations come up that are unprecedented, like parents would homeschooling their children, they have these real needs for respite that can't be addressed perhaps by NDIS funding that's already in place, or perhaps they have these emerging needs that they didn't have before. The Carer Gateway is able to step in and provide support for people in times of increased need, when they need it, when it can't be accessed from other avenues. So we had some very relieved parents that were able to receive extra respite to give them a break, especially during that difficult homeschooling period, to provide them with that relief so that they can carry on. That's just one example. Now coming up to Christmas and school holidays, again, that is another time where there's an increased need for things like respite, where we can step in and provide that short-term support in times of need.
That's excellent. We've had a question that's come through from Giuseppe on the Q&A box, and Giuseppe wants to know, he's heard a bit about these $3,000 packages, but he's not sure exactly what they are and what he can get for his $3,000. And so he's wondering whether you can explain more. What's all of the fuss about the carer-directed packages?
Absolutely. That is tricky to answer because all carers have such different needs, and what we can provide to you needs to be in relation to a direct need that you have. So not all carers are technically entitled to the same types of supports, but to give you an idea, carers have access to up to $3,000 of funding with the carer directed package, and that may involve multiple different types of supports. For example, personal care for the care recipient. It may involve domestic assistance. It may involve respite. It may involve transport. It may involve funding for equipment. It may involve funding for pre-prepared meals. But essentially, all of those different types of services are coming from one budget, and we work with you so that we can provide the most appropriate support for you out of that package. And I would encourage all carers to register with the Carer Gateway and have the conversation. When they're referred to their outlet partner, we will be transparent with you. We will explain what you are entitled to, and we can really clarify what you as a carer can access. So if anyone has any concerns or they need more clarity, we would encourage you to register and we will be there to explain it.
Now, Laura, we might have a few young carers who are joining today's webinar, or that they know people who are young and who are carers within the community. I'm just wondering if for all of those individuals who might be out there on the webinar, or who want to pass on information to friends, family, how you would say that the Carer Gateway engages with young carers?
So young carers is an area that we would really love to increase awareness in the community. I would say that most of the young carer referrals may be coming from parents themselves, or directly from schools or other organisations like Little Dreamers, for example. But we are really working on trying to connect with as many young carers as possible. They're one of those groups that's really that doesn't receive enough support in the community, and we're really trying to work with them. One of the Carer Gateway's main focuses is to provide educational support, especially for young carers, so that we know that they can get access to support through education, and there are no barriers that may have come up through the caring role. We're there to support them during that process to make sure that they have the best possible future that they can.
Oh, that's a really thoughtful response there. Laura, I want to thank you for your time and your presentation, and also for quick thinking and being able to overcome the technical difficulties as well too. That's very much the theme for 2020, is the gremlins that are in the system. Stay very much in the conversation, keep your video on. And I'm also going to ask Sasha to come back as well too, because we have a few more questions that we've received, and Vicky as well too. You're more than welcome to be part of the conversation as well, as we round it all off. This one, I might direct it to Sasha first. This question's come through from Ray, and Ray has said, in our caring role, we have found that there is a missing component if the person you care for becomes violent and might need restraining for their safety. And the only people that they've been advised to call is the police and possibly a CAT team. Does the Carer Gateway handle this, as we've been really beside ourselves with concern a number of times, and also that the NDIS hasn't quite had the capacity to deal with the situation? So Sash, that's the question that Ray's handled. I'm wondering whether you can relate to this from any types of conversations that you've had during your involvement with the Gateway.
Yeah, absolutely. Thank you, Ray. I think it's a really good question to ask. I think it is really important that these conversations are had, because the reality is that these are some of the situations that carers are facing day in, day out, and not to sort of just talk about the easy or the good things that do happen. Certainly, I've had a number of these situations over the last 7 months that I've been in the role, and it really depends on the circumstances as to how we would respond. The first and foremost part of how we would respond is making sure that you're safe. So if the violence is escalating and you are not safe, it is important that the CAT team or the police are involved, as you've been identified to contact. Having said that, there are nuances to that discussion. So we do also have a relationship with adult respite services that have specialised 24-hour care, and that we can arrange a pretty quick stay for the person that you care for if the violence isn't at a stage where it needs to be managed medically or by the police, but you do need that break and that separation from each other to de-escalate the situation. So we have a great relationship with a disability service provider called Possibility that can provide 24-hour care in a really safe place for somebody with complex and challenging behaviours. It's also a situation where I would be in touch with the NDIS support coordinator to facilitate any respite that we can put in place. So there are times where I've had conversations with NDIS support workers. We've got known workers in and able to provide overnight support within the day or the next day. Sometimes getting someone else into the situation can de-escalate the challenge that's happening as well. So it's a real case-by-case scenario. It is a challenge. We definitely don't have a cookie cutter approach to how we would respond. There's been times where, particularly with young children on the spectrum that may be displaying complex behaviours, sometimes having that seeing a police officer just in and of itself can help to de-escalate the situation. So sometimes we'll call the police just to come and have a chat to the child, and that can help as well. I guess then it's really about managing that emergency situation and containing it, stabilising it, calming the situation, and then I would do that handover where I would call Laura, for example, and Laura would take over for that more longer term planning.
Thanks, Sasha. That's an excellent insight there. I might put this question to Vicky. It's come through from Eleanor. Eleanor has said that her husband requires a new wheelchair and the wait time to get the wheelchair is really huge. Is this something that the Carer Gateway would fund?
What we normally do is we would look at whether your husband's receiving NDIS supports or My Aged Care, because the purpose of the Carer Gateway is really to support the carer, and it acts as a it's like a top-up service or an adjunct to other services that are already available in the community. So what we do was look first at whether there is a possibility for My Aged Care NDIS to fund the support. We could make a contribution to it, but what we would do is we would look at first what's available out there. Can we access other supports? And if there's a bit of a gap, we could potentially assist.
Thanks, Vicky. A question for Laura, and then I'll put one general question to the three of you before we come to a close for today's webinar. Laura, the question that we had, it came through from Mark. Mark wanted to know whether or not the Carer Gateway would be able to fund his transport needs. So at the moment, he's having to take a lot of taxis with his care recipient, and wanting to know whether that's something that the Carer Gateway could assist with.
Thanks, Evan. So transport and most types of services such as that, they're all case by case. So as Vicky said, what we would do is we look at the situation and we try and work out what are the other possible avenues. Can we link you with a volunteer service? Is that something that in your next plan review meeting, is there capacity to provide funding for transport assistance? The reason why we like to look out for external avenues is to make sure that you are never without support. And we want to make sure that you're connected in with all possible avenues. But if the situation is relatively short term, something has come up, you have this increased need for transport that's related to your caring role, then yes, we can look at funding that. And there are multiple different ways that we could arrange that, whether it was potentially taxi vouchers or payment for petrol, or whether it was actually employing a support worker to transport the care recipient on your behalf, all case by case. But yes, there's definitely things that we could look at for transport.
Thanks, Laura. And one general question and just a quick response from the three of you as we finish it off. That question is for all the carers that are out there and they're unsure about engaging with the Carer Gateway and they're a bit scared about accessing a support service. What advice would you give to them? I'll start with you, Vicky.
I think there's no harm in asking for help, and we're only here to put in services that you need. We're not here to impose anything on anyone. So if you're feeling a little bit reluctant, I'd still encourage you to call and just talk through your options with our intake team and with the assessment and planning officers, because you might discover that there could be some supports out there that you've never considered before, and at least you'll feel less alone, and you'll feel some, sort of support from us. So I encourage people to contact despite feeling unsure.
Thanks, Vicky. Sasha, your advice?
Yeah, absolutely. So if you're not feeling at a stage where you are able to pick up the phone, it could be a really good option, as Vicky mentioned earlier, to get us to call you. So you can jump on the website and put in your details and we'll give you a call. I know sometimes it can feel really hard to make that first step and actually make that initial call. And yeah, as Vicky said, there's so many different options of things we could do. The counselling program that we have is carer specific. So many people have accessed counselling before and it hasn't necessarily specifically addressed the caring role. And the great thing about our counselling program is that it's an opportunity for you to, maybe you don't even identify yourself as a carer at this stage, or just at that initial stage of really seeing your caring role as something beyond being a family member. So that could be a really good place to start, simply just having some counselling.
Thank you, Sasha. And then last to Laura.
I've worked with multiple carers who have disclosed their apprehension about registering for carer services. They may be worried that they're going to be let down, they're going to be left without support. They are reluctant to accept help. There's multiple reasons, but we work with carers so closely. We understand the types of issues that they experience. I just want to reassure everyone that all the staff at the Carer Gateway are very understanding and empathetic, and we're there to support you. If you have any concerns around anything, then please don't hesitate to contact us and we will do our best to make you feel supported.
There are some excellent words of advice and encouragement there. I'd like to thank our three speakers for today. Vicky Down, State Manager for the Carer Gateway in Victoria, Sasha Lilford, the Senior Care Advisor, and Laura Humphries, almost made a meal of it right at the end there, who's an Assessment and Planning Officer working for the Gateway and based at Uniting. It's been a real pleasure hearing from the three of you and understanding different parts of the Gateway. I'd like to thank everyone who has joined today's webinar, and thank you all for your questions as well. A thank you too also to Amanda Nichols, who has provided some information in the chat box on how to access support for carers assistance, and I'm sure that that information will be able to find its way through to you as well. For more information on the Carer Gateway, please do visit the website, www.carergateway.gov.au. There's lots of great resources there. As Vicky said, make sure that if you do reach out, if you feel as though there's a need to reach out, and we're only a conversation away. So until next time, wishing you all the best from the Carer Gateway and all the best for 2020.